Good morning. In this scenario, I am on ward rounds and I noticed that a junior doctor colleague appears intoxicated. They are behaving inappropriately, have impaired coordination, and there is a smell of alcohol on their breath while they are actively reviewing patients and writing medical orders. My immediate priority would be of patient safety. And in dealing with patient safety and in accordance to the medical code of professional conduct, doctors should have a duty to protect patient from harm or inflicting any harm and to act if colleague fitness to practice is impaired. So that leads to several plans. And first, number one, I would avoid confronting the colleague aggressively or publicly humiliating them. I would approach them calmly and discreetly, perhaps asking to speak privately away from patients and stuff. I would express concern in a non-judgmental manner, for example, saying that I'm concerned you may not be well enough to continue your duties right now. And if I genuinely believe that the colleague is impaired, I would ensure they stop seeing patients immediately. Very important, because this was, and I would escalate the matter to a consultant or a specialist in charge in accordance to hospital protocol. Would also ensure that the patient's safety is handled safely to other clinician, and at the same time, I would remember that colleagues may have experienced burnout, stress, substance misuse, or personal difficulties involving families or relationship. While protecting patient comes first, I need to also remember that doctors also have responsibility to support one another. Therefore, I would encourage the colleague to seek medical assessment, occupational health support, counseling, or maybe professional assistance programs available within the hospital. And in the longer run, proper documentation and report must be done. This is not intended as a punishment though, but to ensure accountability, rehabilitation of a colleague, and prevention of future risk to patients. And not to mention several ethical principle guides my action right now, which beneficence is acting in the patient's interests. Non-maleficent means preventing any harm, and professional integrity requires doctors to maintain trust in their profession, and justice ensures that patients receive safe and competent care. There is also compassion and respect for the colleague as a fellow healthcare worker and ultimately as a human being. And one major challenge in this situation is balancing loyalty to a colleague with the duty to protect patient. There may also be fear of conflict, confrontation, damages to workplace relationship, or uncertainty about reporting procedures. However, failing to act would place patient ultimately at serious risk and would itself be unethical. So in conclusion, I would prioritize patient safety immediately, escalate the concern appropriately, and support my colleagues with professionalism, compassion, empathy, confidentiality, while following the medical code of professional conduct.